Hello, my name is Mallory. I'm your nurse today. Can you tell me your name and date of birth?
Yes, Morgan Douglas, 4/8 of 1998.
Perfect. Okay, so I was looking at your chart, and your doctor was informing me that he recently prescribed beta blockers. Are you familiar with how those medications work?
Not really, a little bit, but I like more information.
Okay, so the main reason why people are prescribed those usually is to help slow their heart rate down and decrease their blood pressure. So what it's doing is blocking the hormone epinephrine, which is slowing the heart rate down, slowing the blood pressure so it's not quite as high. So what I'm going to teach you today is how to take a couple pulses, just so you are familiar with that and just so you can know if it's out of range, just to know if the medication is overcorrecting your blood pressure. So by the end of this session, you should be able to check several different pulse sites in case you can't find one.
Okay.
Be able to tell if your pulse rate is in the range, which is 60 to 100.
Okay.
And also I'm going to show you a couple ways to check your extremities to make sure you're getting adequate blood flow. Because if you're not getting the correct blood flow, then you're probably not having adequate blood pressure through your body. So the first pulse site, probably the most common, is your radial pulse, which is right here on the inside. You're going to want, right here, yes.
Okay.
You're going to want to be using your pointer finger and your middle finger. You can kind of feel around there so you feel that pulse.
Yeah, I feel it.
The next one, probably if you can't feel that one, the one that you should be able to feel is your carotid. It's going to be right here on the inside of your neck.
Okay, yeah.
Can you feel that one
Yeah,
too? And another one that you could check also is your brachial pulse, which is right here on the inside of your arm.
Right here?
Yeah, you should be able to feel it right around and through here.
I feel it right there.
Feel it?
Yes.
So most of the time, whenever you find your pulse, count for 60 seconds.
Okay.
Whatever that is, that should be in between 60 to 100. Also, if you just want to count for 30 seconds, you can do that. And then just multiply by 2.
Okay.
So, tell me the pulse sites just again so I know you're familiar
Yeah,
with them.
okay, the carotid is right here.
Perfect.
This is the radial. This is one I'm probably going to check first. And
Okay.
then I'm going to go here. And this
Perfect.
is the brachial, and it's inside right here. And I'm checking for 60 seconds. And then, or I could do 30 seconds and multiply it by 2.
And what should it be between?
60 to 100 beats per minute.
And like I was saying with the circulation to your extremities, so when your heart pumps, that blood goes out to the rest of your body. So one thing you could check is your capillary refill. So if you press down on your nail bed, it will turn white, and it should return back pink within about 3 seconds. That means you're just getting adequate blood flow to your fingers. Also, you can do that to your toes as well, but if you're getting that, you should be able to feel your pulses.
Okay.
So if you can't quite find it the first time, just keep kind of feeling around. If you can't feel that, definitely just check your carotid.
Okay.
So do you have any other questions for
I
me?
don't think so. I think you answered everything for me.
Perfect. Okay, if you have any questions, just let me know.
All right. Thank you so much.